wellness clinic, you're able to book an appointment where you can come in before you develop any complaints. Even when you're feeling okay, it is important for you to know how you're standing regarding the risk factors for cardiovascular heart disease. To start, you'll meet our comfortable outpatient services, which are staffed by qualified cardiologists, nurses who have specific training in cardiology procedures and care. And these clinics run from Monday to Sunday, so you can book any day that's comfortable for you, whether the weekdays or the weekends, and you are going to be served. In here, we offer first consultations where you'll meet an expert to present all your complaints or whatever you want to talk to them about, and they'll take your history, they'll do the necessary physical examination, and that will lead you to the necessary diagnostics. And our range includes echocardiogram testing, electrocardiography, Holter recordings, treadmill testing, but all these are offered as and when necessary depending on the complaints that you have come with. Second, we have emergency services that are available starting from our well-equipped accident and emergency units, where you'll meet qualified staff members, nurses with cardiac training, ready to make that initial assessment and then to be immediately joined by the cardiologist on duty to serve you adequately. These are the procedures that we do for people who get into heart attacks or acute coronary syndromes. We are also able to offer different types of pacemakers for the people with heart rhythm problems or any other indications for pacemaker insertion. We are also able to insert filters for the people who have blood clots and we want to prevent the clot from moving from the legs to the lungs. And all this will be done in a timely manner and by a range of staff members that you can trust that you're going to have the best outcomes. Thereafter, we have high standard, high dependency unit and intensive care unit facilities where the patients who have left theater are going to be looked after, or even if not after a procedure, but any patient with a heart emergency, a cardiac emergency, or in a critical condition that requires close monitoring, our HDU and ICU facilities are available to serve you with close monitoring, with high level of training of our staff members to make sure that you have the best outcomes for you or your loved ones. Those are the things that you may have which are painless, but if not discovered early or treated, you can end up having all the complications of hearts and strokes and other things that you hear people talking about. So you want to come in and get to know what is your blood pressure. You want to know what is your current weight sufficient for you? Is that what you are supposed to be having? You want to know what is your cholesterol level. And there are several other blood tests that we measure which are able to tell us your risk that you're standing for having heart events or other complications. So you do not have to wait until that complication has hit. The earlier you come in, the better. It's a good ambience. There are dedicated staff who are waiting to serve you in a very comfortable flow to make it easy for you.